But we also get to deliver them the news that, hey, the unit that you help donate is going to somebody in need, and you can tell your son or your daughter that they helped save a life today. So that's really cool.
Hello there. You just heard a snippet from Emily Pajcic about the life-saving power of a cord blood donation, which we'll be learning even more about in just a bit. If this is your first time tuning in, my name is Lauren Ryan, host of this podcast and the Community Education Program Manager here at Cancer Pathways. We are officially in full swing Camp Sparkle season as the summer is progressing and the weather is certainly heating up. A bit later this month, I'm excited to bring you along with me to get a glimpse into the powerful connections and healing that happens at Camp Sparkle each year. Now, for this episode, I had the pleasure of talking with Emily Pajcic and Chelsea Price, who work at Bloodworks Northwest. Bloodworks Northwest is an organization that I have greatly admired for several years now, having donated many times myself and through organizing blood drives with them. Emily was previously a labor and delivery nurse for over 10 years and now spends her time working with the cord blood donation program at Bloodworks as the cord blood donor and collections supervisor. The cord blood program partners with hospitals in the Seattle area where they work together as a team to raise awareness to public cord blood banking by training hospital staff on how to collect donations, actively participating in community events, and partnering with prenatal classes for expectant parents. Chelsea has over a decade of oncology nursing experience in team management. She now works as a clinical nurse educator for the cord blood donation program at Bloodworks, where she trains the labor and delivery staff at partnering hospitals on how to do collections and educates potential donors about the benefits of publicly donating their cord blood. Let's jump into my conversation with Emily and Chelsea, where they share more about their work and the importance of cord blood donation. Hi, Emily and Chelsea. Thank you so much for joining me today. I would love to start by hearing more about what you each do at Bloodworks Northwest. Let's start with you, Emily.
Yeah, thank you, Lauren. Thanks so much for having us. We're excited to be here. My role is the cord blood donor and collection supervisor. I'm kind of like a liaison between our partner hospitals in our cord blood program. And so I help increase our collections for potential donations or for potential transplants for patients in need of a stem cell transplant.
Awesome. How about you, Chelsea?
Hi, thanks for having me, Lauren. So I'm one of the clinical nurse educators for the cord blood donation program. And I go out and work with the hospital staff and potential donors. So I'll work with the labor and delivery staff, teaching them how to do collections, teaching them why the importance of doing a collection. And then I work with potential donors in prenatal classes. We will provide education about doing cord blood donation as part of their birth plan and providing the OB offices with patient education materials to hand out.
Awesome. So this is kind of a very straightforward first question I have for you guys. But for those who are listening and maybe wondering, first off, just what is cord blood and why is it important?
That's such a great question because so many people don't know. Umbilical cord blood is the blood that's collected or I guess expelled from the cord after a newborn is delivered. Usually it's medical waste unless someone plans to, in this case, donate, or if they want to privately bank their cord blood, or if they're involved in some sort of research project. If it is, like I mentioned, if it's not one of those, then it's just medically discarded or considered medical waste. Cord blood is so important because it provides more opportunities for HLA matching for patients who are in need of a stem cell transplant. There's less graft versus host disease. It can be readily available, kind of like a cord blood bank, or I'm sorry, kind of like a blood bank. It also provides more opportunities for patients in need of a stem cell transplant. Donations that are unable to be used for transplants can provide opportunities for research and treatments that foster off of stem cells. Bloodworks participates in so many things outside of just blood donations, which are also very important. I will say that. And I should know that Bloodworks supplies more than 95 hospitals in the Pac Northwest, which is really cool. But however, we touch on so many areas of patient health, from research to biopharma and CAR T cell therapy and other donation opportunities like the cord blood program. So
Awesome. I'm so glad we're having this conversation because I actually just had the opportunity to talk with NMDP and we have kind of like a donation campaign going with them. So I feel like this ties in really nicely.
Oh, that's so great. We love the NMDP. So
Yeah. What diseases or conditions are treated with cord blood stem cells?
So cord blood can treat over 80 different diseases at this point, and there's so much research going on. Some of the treatments that we use cord blood for now are typically with cancers that affect blood cells like leukemia, lymphoma, multiple myeloma. Then there are also congenital disorders like sickle cell disease. There are also autoimmune disorders, myelodysplastic syndromes. And some of the research that we're using cord blood for right now is towards HIV, Alzheimer's, juvenile diabetes, cerebral palsy, spinal cord injuries, burn injuries, the list goes on and on.
Oh my gosh, that's amazing. I did not realize it was so many different conditions that cord blood is being used for. And then Chelsea, I would love to hear a little bit more. Can you walk us through the process of donating cord blood? I know you mentioned that you work with people who are about to maybe have a child and integrating cord blood donation into their birthing plan. Can you talk a little bit more about that process?
Yeah, definitely. So when we have a donor who would like to make donating their cord blood part of their birth plan, once they are admitted to the hospital for delivery, they should let their admitting nurse know that they would like to donate their cord blood. There is some paperwork that they need to fill out, which they can do at the hospital. We provide the consent form and this donor screening form that they need to fill out to all of the hospital sites. If patients wanted to, they could go to our website, print it off, and fill it out ahead of time. We also provide that paperwork to some of the OB offices. So either way, they can fill out the paperwork before or when they are admitted to the hospital. We will ask them to let the nurse know that they want to donate prior to getting their IV placed to decrease the number of pokes the patient will receive, because we need to take some samples from the birth mother. And so we need to get some vials of blood, and they can do that at the same time the IV is inserted. Then after that, the labor and delivery staff is going to take over everything else. They're going to get all of the supplies ready prior to delivery. And then after delivery of the newborn, the physician will clamp and cut the umbilical cord. The umbilical cord is cleaned, and then a needle is inserted, and that's how we collect the blood from the umbilical cord into our collection bag. And then the physician is going to hand off the bag to the nurse who's helping out to get that all packed up with those samples that I had mentioned and the paperwork, and sent back to Bloodworks.
Awesome. So is somebody who's expecting a child, is all they really need to do to prepare is kind of know the information on the front end and then come to the hospital knowing that they want to donate cord blood?
Yes, exactly. They can also, when they're admitted to the hospital, if they don't have information about cord blood donation and it's offered at the hospital they're delivering at, the nursing staff there can also give them a brief rundown, or if they have any additional questions as well.
Awesome. I love how easy and simple that process is. It doesn't take like a lot on the front end.
Yes, exactly. It's very simple for our donors.
We try and make it as easy as possible. And I do, like Chelsea said, hopefully patients can get this education or like a pamphlet or any kind of donor information ahead of time in their clinics. And we try and be proactive and get that out to them. But if not, they can definitely get information at the hospital coming in for delivery or any time in between.
Awesome. So while you guys are working at hospitals or with donors, or just patients, what are some common misconceptions you hear when it comes to donations?
Yeah, so there are some common misconceptions that we hear from donors. The first one is that donors can get confused with public donation versus private banking, and donors will think that they have to pay to donate their umbilical cord blood, which they do not. Is completely free service. Everything is covered, so no payment from donors. They don't need to bring anything with them at all. Like we said, they can just fill out that paperwork, but they don't need to bring any supplies whatsoever. Patients also think they can't do delayed cord clamping and donate their cord blood. Something that patients may like to do is do what's called delayed cord clamping, where maybe they wait 30 to 60 seconds before clamping that cord after delivery. And we can actually do both of those things. So if a patient would like to do a delay, we can prepare the cord by doing the cleaning process during that delay, 30 to 60 seconds, and then begin the collection right afterwards and still get an adequate amount of blood for a donation for a potential transplant. And then the last common misconception that we hear is that patients think that when they are looking for a match for a transplant unit, that they think they will be able to easily find one within their family. There's actually only a 30% chance of finding a match within your family, and they're most likely going to need to go to a public registry to get that donated stem cell unit.
So that's why we talked a little bit, like I mentioned, with NMDP about diversifying the donor database and why that's so important. I feel like it ties perfectly into this as well.
Yes, exactly. Patients who are looking for a donor outside of their family on that public registry are much more likely to find a match from someone of a similar ethnic or racial background.
I'd love to hear how you work with hospitals and birthing centers to promote and facilitate cord blood donation. Can anyone in Washington State that's delivering a child participate in this program?
Ugh, I wish that was the case. However, right now we're only partnered with 6 local hospitals and 5 Hawaii hospitals in Oahu. Um, so unfortunately, they have to be at one of our partner hospitals because we have to train the nursing staff and the providers. We have to have our trained collectors, and we also will stock our supplies there, our education information, the paperwork that needs to be filled out, all of the kits and the collection supplies are all at these hospitals as well. So those sites are Evergreen Health, Overlake, Swedish First Hill, Swedish Issaquah, University of Washington, the Montlake campus at this point in time, and then Valley Medical Center.
I'd love to just hear also a success story from each of you from working in the community. Do you guys have something that you'd like to share or something that kind of sticks out to you?
Well, I have had a couple of friends who have recently donated their cord blood, which was very exciting. And they were said very seamless, straightforward, and super easy. And so what we hear from many donors is that they don't even know that it's happening because after delivery, they're busy bonding with their newborn. And so they're completely unaware that we've even done the collection. Sometimes they even ask, did you forget to do it? Or you
Mhm.
which is great for them that it's, not harmful to them and not interfering with the bonding of their newborn.
Do you want to talk about the nurse at First Hill?
Yeah, sure.
Okay.
So one of our partnering hospitals, Swedish First Hill, we have a nurse who is working there who over 10 years ago collected a cord blood unit. And just a couple of months ago, that cord blood unit that this nurse had collected was sent out for a transplant for a patient. And so both Emily and I actually went to Swedish First Hill together and found that nurse who was working, and we were able to tell that nurse that the cord blood unit she had collected over 10 years ago was just sent out, and it was very exciting to let her know because she was so excited to hear that information, but also for the rest of the staff there, just to remind them of the good work that they're doing these collections to help potential patients in the future get a stem cell transplant.
And that was actually really fun because she was an
Mhm.
old coworker of mine. I used to be a labor and delivery nurse before this role. And so it was just really exciting to be able to deliver that news to her. And when people get that news, they're so excited. And you see something like light up in them, like, oh yeah, this is why I'm doing this. This is
Oh,
why I'm
yeah.
collecting this donation. Because we have to be real about it. It does add some work for nurses and the staff. So we aren't naive there, but I think that kind of reignites the fire in them too and encourages them to help with donations.
Oh, for sure. Hearing those stories like makes it so tangible for them. Especially, I'm surprised to hear it's like 10 years later. So you guys obviously, track from when it's like collected to when it gets sent out. But you also track like the nursing staff that does the collection as well, it sounds like.
Yeah, we have all those records. And like I mentioned before, one of the benefits of having cord blood stored is that instead of, say like a bone marrow transplant, somebody is looking for a donor there, an adult bone marrow transplant, they have to find the donor, they have to do the testing, which could take days, weeks, months. However, with cord blood, if we can store these ahead of time, we have them ready to go. And we do partner with NMDP and add to their registry, but we ship worldwide at this point. So if a patient in France, I think we might have shipped there recently. That's why it's on my brain, but
Hmm.
we can ship to them usually within a week. It can be sooner if it needs to be rushed, but that's ideally in about a week. So they're they're just stocked and ready. And at this point, we have cord blood units that are over 20 years old
Oh my gosh.
here in Seattle. So that's,
Wow.
and I think I know we have at least 14,000, but maybe almost 15,000 cord blood units just at our central location alone.
Wow. Amazing. Do you have a specific success story or something from the community that kind of stands out to you, Emily?
Like I said, I was a labor and delivery nurse before this. So actually being a part of the collection process and being in deliveries was really special with patients. I do have a niece who's had a stem cell transplant in the past for cerebral palsy, but also in this role, we get to call the donors, like say this unit that Chelsea mentioned was 10 years later. We have to call the donors and try and get a hold of them, just make sure that their medical history hasn't changed too drastically and we can still use this unit for this patient. But we also get to deliver them the news that, hey, the unit that you help donate is going to somebody in need, and you can tell your son or your daughter that they helped save a life today. So that's really cool.
That's really cool. Super special, especially I'm sure for like a 10-year-old to hear of just like, wow.
Not only that, yeah, that is really cool.
Mhm.
That's one of my favorite parts of calling donors.
Mm-hmm.
Um, but we also try and find cord blood recipients to help advocate for cord blood donations and try and reach the collectors like nursing staff or doctors, like I said, to try and light that fire again. So we did a podcast with a couple different cord blood recipients who had just amazing stories. One was a pediatric sickle cell patient who is now, I think she's 24 years old, no sickle cell. And then another was an ALL patient. Um, so hearing their stories is just, it's great. They do a lot of webinars and a lot of advocating for the NMDP and for the program in general. But
Yes, even one of my colleagues, she herself got a cord blood donation, or she was the recipient of cord blood when she had leukemia as a child. So she just talked about it all the time of like how important it was to her, of course.
oh, that's awesome. We'll have to hear her story sometime.
Yes. She's been on the podcast. I'm trying to remember which episode she's been on. I think it was talking about our teen cancer risk reduction program. So it wasn't specifically her cancer story. But whenever she talks about it, it's always like very eye-opening. So I've wanted to do an episode focused on cord blood for quite some time now.
Very cool. Yeah, a lot of people, I mean, it's been around for a while now, but a lot of people don't truly understand what it is, what all it
Mm-hmm.
entails, how easy it is. It just goes to waste if it's not used.
Yeah.
Um, and like I said, just so much research, so many treatments are using cord blood as kind of like a starter for a potential drug or treatment for um, so many different things these days.
Yeah,
It's just amazing what they can do.
absolutely. So, like you said, a lot of people tend to not know about it to no fault of their own. It's good information for people who may be expecting or prepping to have a baby to just know that it's an option. How can we and listeners, people listening to this podcast, help to raise awareness in the community about cord blood donation?
I think just talking about it in general. Actually, I'm gonna let Chelsea talk. She was just telling me a really cool story about telling someone about it. So
Yes, of course, we want people to talk about it with people in the community who are expecting, but I think also telling people who aren't expecting. I had a family friend's dad recently tell me he read some article about a cord blood stem cell transplant. I don't remember the details of this article. However, he told me that he would have never looked or read at this article had he not heard that this was my job. And so even just educating people who aren't expecting is great because you never know who they may tell that
Totally.
same story to. So I think just getting the word out is so helpful to anybody.
yeah, and you can also go to our website, bloodworksnw.org/cordblood. You can share the word with friends, relatives, especially those who might be expecting or planning a family anytime soon. We do post regularly about cord blood donation on our social media page, so you can also follow Bloodworks at Bloodworks Northwest on all channels if that's something of interest to you. So there are cool
Awesome.
ways, yeah.
I appreciate you guys saying too that it's not just about like expectant mothers because you never know like how that chain is going to happen of somebody telling someone. I tell people I do this podcast and they're like, "Oh, I've never been impacted by cancer," or they're a younger person and they're like, "I'm young, like I wouldn't be affected by cancer," and I'm like, "Well, maybe that's not true. Maybe you'll know somebody, who you might hear an episode and you're like, oh my gosh, this person needs to hear this information." So I really appreciate you guys saying that.
Yeah, thank you so much for having us. We talk cord blood 24/7. So
Yeah.
we're just excited to get the word out there and talk about it some more.
That was my conversation with Emily Pajcic and Chelsea Price with Bloodworks Northwest. As always, all the important links to learn more or get involved are included in this episode's description. I hope you learned something new and were maybe even inspired to add cord blood donation into your birthing plan. If so, please share this episode with a friend or family member and don't forget to follow and rate our show in your podcasting app. Until next time, please stay healthy and well.